Imagine waking up and not recognizing someone you love, or reaching for a familiar word and finding nothing. For over 55 million people worldwide, this is daily life. This is dementia, not a single disease, but a condition that gradually affects memory, thinking, and independence. In this video, we'll explore what it is, its symptoms, treatments, prevention, and how families can provide support. What is dementia? First one, let's be clear about something. Dementia is not a normal part of aging. Forgetting where you put your keys? Normal. Forgetting what keys are for? That's different. Dementia is an umbrella term for a group of conditions caused by abnormal brain changes. These changes trigger a decline in thinking, memory, and behavior, severe enough to disrupt daily life. The most common form is Alzheimer's disease, which accounts for 60 to 80% of all cases. Others include vascular dementia, the second most common type, along with Lewy body dementia, frontotemporal dementia, and mixed dementia, which combines multiple types at once. Every year, nearly 10 million new cases are diagnosed worldwide. That's one new case every 3 seconds. Pathophysiology. What happens inside the brain? So what's happening inside the brain? In Alzheimer's disease, 2 proteins cause damage. Amyloid beta forms plaques that block communication between brain cells, while tau protein becomes tangled, disrupting the structure of neurons. As a result, brain cells stop working and eventually die. In vascular dementia, reduced blood flow, often from strokes, deprives parts of the brain of oxygen, leading to tissue damage. In Lewy body dementia, abnormal protein deposits inside neurons interfere with thinking, movement, and sleep. Across all types, the outcome is similar. Brain cells are progressively lost, the brain shrinks, and key areas like the hippocampus, responsible for memory, are affected first. Signs and symptoms. How do you know when something is wrong? Dementia has a recognizable pattern of warning signs. Knowing them early can make all the difference. The 10 key warning signs to watch for are: 1. Memory loss that disrupts daily life. Missing appointments, repeating questions, forgetting recent conversations. 2. Difficulty planning or solving problems, like following a recipe or managing monthly bills. 3. Trouble completing familiar tasks, driving a regular route, operating the stove, or playing a lifelong card game. 4. Confusion with time or place. A person may not know what year it is or believe they need to go to a job they retired from decades ago. 5. New trouble with words, struggling to find the right term, stopping mid-sentence, or calling objects by the wrong name. 6. Misplacing things and being unable to retrace steps, and sometimes accusing others of stealing. 7. Poor judgment, making unusual financial decisions, neglecting personal hygiene, or falling for scams. 8. Withdrawal from social activities and hobbies they once loved. 9. Changes in mood and personality, increased anxiety, depression, suspicion, or sudden aggression. 10. Changes in behavior that may actually appear even before memory problems. This is often the earliest and most overlooked sign. These symptoms don't appear all at once. They creep in quietly, and that is what makes them so heartbreaking to witness. Treatment, medicinal. Now for the question everyone asks first. Is there a cure? Not yet, but there are medications that can slow the progression, manage symptoms, and significantly improve quality of life. Cholinesterase inhibitors, including donepezil, rivastigmine, and galantamine, are the most commonly prescribed for mild to moderate Alzheimer's. These drugs work by preserving acetylcholine, a neurotransmitter crucial for memory and learning, by blocking the enzyme that breaks it down. They won't stop the disease, but they can improve function and buy valuable time. For moderate to severe Alzheimer's, memantine is used. It regulates glutamate, a brain chemical involved in learning. When glutamate is overactive, as it is in dementia, it can cause further neuronal damage. Memantine helps block that process. In 2023 and 2024, a new era began. The FDA approved lecanemab and donanemab, the first anti-amyloid immunotherapy drugs shown to actually slow cognitive decline in early-stage Alzheimer's by targeting and removing those toxic amyloid plaques we talked about earlier. These represent the most exciting breakthrough in decades. Treatment, non-medicinal. Here's what many people don't realize. Non-pharmacological interventions are increasingly the first line of management, especially for behavioral symptoms, and they work. Cognitive stimulation therapy, structured mental activities, word puzzles, music, and discussions has been shown to improve memory and mood, particularly in mild to moderate dementia. Reminiscence therapy invites patients to revisit meaningful memories through old photos, songs from their youth, or familiar smells. It reduces depression, increases engagement, and restores a sense of identity. Music therapy is remarkable. Even in advanced dementia, when verbal communication is almost gone, patients respond to music. Physical exercise, even gentle chair yoga or walking, improves blood flow to the brain, reduces behavioral symptoms, and boosts mood through endorphin release. Validation therapy teaches caregivers not to correct or argue with a confused patient, but to acknowledge their feelings and emotional reality, reducing distress and increasing cooperation. Animal-assisted therapy, aromatherapy with lavender or rosemary, structured daily routines, and maintaining a clutter-free, visually clear home environment all contribute meaningfully to stability and calm. How families can help. Family plays one of the most important roles in dementia care, often providing hours of support every day. While the responsibility can be heavy, the right approach can make a meaningful difference. Start with patient communication. Speak slowly, clearly, and calmly. Use simple words, maintain eye contact, and avoid arguing. Focus on understanding their reality instead of correcting it. Create a consistent routine. Keeping daily activities like meals, sleep, and tasks the same each day helps reduce confusion and anxiety. Ensure a safe environment. Remove fall risks, secure dangerous items, and use simple labels or cues to make navigation easier. Safety supports both independence and dignity. Encourage involvement. Support the person in doing tasks they can still manage, even if it takes longer. Staying engaged helps maintain confidence and a sense of purpose. Use familiar memories. Photos, music, and familiar activities can be powerful tools for connection, as long-term memories often remain stronger. Take care of yourself as a caregiver. Burnout is common, so it's important to take breaks, seek support, and ask for help when needed. Plan ahead early. When possible, involve the person in decisions about care, finances, and legal matters to reduce future stress. Dementia changes how a person functions, but with consistent care, understanding, and support, families can greatly improve quality of life and maintain meaningful connections. If you found this video helpful, share it with someone who needs it. Subscribe for more content on brain health, caregiving, and aging. And remember, no one should face this journey alone.